Hello, good morning. I'm here. It's the first of a whole series this week of lives every morning that I'm doing both on Instagram at 9 o'clock and then jumping over to Facebook at 9:30. And this is all we're doing a summer sale event on our advanced theory course, which is Understanding Scars. It's a self-paced course. Really in depth with everything that you need to know, whether or not you're really experienced already with supporting people after injuries and trauma, or whether or not you're totally new to this and you really want to get to grips with how you can help your clients who've perhaps gone through a surgery or had a trauma. And just that course alone is really going to equip you with lots and lots of information about how to support them. Hiya, Hilary. And so I've got a 50% sale on that course. And if you've already signed up to it, but maybe it's expired, you can also renew on a month-by-month basis, so you can dip back in and get a bit more information out at any time. So if you didn't quite get to the end within the 12 months, then you can also do that. Hiya, Kate. So what am I talking about today? So today is day one. I'm going to be talking about day one is take note documentation for clients after injury and surgery. Tomorrow, if you jump back on and join me, I will be talking about get moving, scar tissue and stiffness. On Wednesday, have a drink, hydration and scar tissue. Thursday, keep it up, fluid build up after trauma and surgery. And on Friday, mix it up using a varied approach to supporting people after injuries and surgeries with your scar tissue treatment. So hopefully something for everyone, whether you're new to thinking about scars or you want to just jump in and listen a bit, learn a bit more. So what should you think about with that documentation that you're doing in your clinic? Certainly some of the individuals who've had a surgery or an injury may decide that they want to go through litigation, so they may want to be pursuing a legal claim relating to the accident or injury they had. So that's one reason why it's obviously really important to keep a good note of what it is that you do and why you did it and what the rationale was, but also to track the changes really well. If somebody's trying to claim that was part of their rehabilitation, making sure that you've got evidence to show what it was you were doing to support that is really important. But I think most importantly is making sure that we meet the client's needs, and by taking your time, and it really does take a bit of time to do a full and thorough intake with an individual, we should really make sure we capture as much as possible in that initial appointment in order to find out if we're actually being effective, if we're helping that individual, if we're putting in the right combination of our skills and experience and knowledge in every single appointment, because there should be a variety of things that you could be doing with that client. Certainly, the way all of my courses are now, it's looking at, okay, well, what's most appropriate, and here's a whole tool set that you could use, here's a whole skill set, here's different approaches to treatment, but what's going to be most effective with what it is you've assessed and picked up in that client intake. So if it is a new surgery, this isn't only about people who've had recent traumas and surgeries, but there may still be lots of discoloration at the scar, and they might be quite concerned about that. So you could start off with taking some details about the scar. There are these really good different rulers for white-skinned and for darker-skinned individuals. If you put that next to the scar and then take a photo, perhaps with the client's phone, or otherwise get permission if you're going to be storing client data and photos of that scar on your phone. By having these have also got like a ruler on them. If you've got a scar which is both a different colour from their normal skin and also perhaps is a bit raised at certain segments, if you've got the ruler next to the scar in the photo, it could be that you're getting incremental changes over a series of appointments, with the scar becoming flatter in certain areas. It's not necessarily going to go all flat at once, but again, you'd be able to capture whether or not there is a big difference easier than just looking at a photo which hasn't got any reference points in it. Obviously making a note of where the scar is, any sort of pulling, puckering, folding, and thinking about what position that individual should be in when you take a photo. Most individuals will be potentially paying for the scar tissue treatment personally, because it's not readily available via the health service. and so they're going to be thinking about whether or not they make a difference. So these rulers are from BAP. So I'm working on getting this one developed with BAP, so they can have the dark skinned one as well, but the light skinned one is from Espia Health. So they're the UK distributors. And they often give them free with orders and things like that. So if you put an order in, you might be able to ask for some. Then the other thing is to think about, kind of range of movement, quality of movement, possibly taking the picture in standing was what I was going to say, so that if they're looking at the scar themselves, it's likely to be stood up in a mirror rather than lying on a therapy bed. But getting lots of different angles can be really helpful as well. And with things like the range of movement and the quality of movement, and again, there are measuring tools where you can, use that to see what range you've got with different joints particularly. It's also looking at their normal. So if you've got a client who's, quite mobile or hypermobile, what their normal is, so they may be able to do a movement which looks like a full range of movement for that limb, but if it's not normal for that individual, that doesn't really feel great. So you should think about, comparing it to the other side, asking them what they used to be able to do would be really good. And then documenting symptoms. So is it itchy? Is it dry? Is it sore? Is it sensitive? Have they got pain? What type of pain? How often is the pain? What brings on the pain? So you can see, you can really sort of take your time with this. There's a lot to capture. Then obviously documenting your treatment. So what did you do? Why did you choose to do that? And how long did you spend doing it? So if you need to be able to sort of reflect back to get that balance right of making sure that you're giving that kind of holistic treatment. And then being able to review back. So if you're not going to see that person for more than a week, then I think it's really important that you ask them to capture how did they feel at 24 hours, how did they feel at 48 hours, because you need to think, well, okay, what kind of change did we get, and how quickly did that change come on? And all of that should feed through to you making clinical decisions on what it is you do next time. So if you can get your clients to diarise what's going on as well, that would be really good. And thinking about whether or not, they might get frustrated and think that their progress isn't really going after a few months. So we often get really good shifts in the beginning of a programme, and then healing isn't a linear line, so often it might sort of stall for a week or two or sort of taper off, and that's what it appears like in the client's eyes. So you need to start being able to think, okay, well, what have I been doing up until now? If I look back at my notes, like, is there something that I could be doing that was different? How might I revisit this programme to either suddenly bring in a new impetus, a new stimulus that I haven't yet thought of, that I haven't yet included? So for me, that could be, maybe I've been doing lots of manual massage and I might think, okay, well, why don't I bring in the cupping? Have I tried the taping? So thinking about different stimulus that could keep things moving forward. Different techniques. Have I done just passive stretching and now I want to do some active stretching within the appointment? So that's asking the body a little bit more, getting them involved. They could be doing a bit more at home? So those would be things I'd be thinking about. And then, are there activities of daily living which have become more comfortable? So looking back at your first appointment and kind of saying, okay, well, let's review where you were at and see, okay, well, what's still outstanding on here that we really need to focus on? So what are the key issues that you've got now, which if it's 2 or 3 months later, might be really quite different from where they started. So those are all some thoughts on what you might want to do with your documentation. I hope that's been a fun little live to watch this morning. Thank you so much for joining. Great to see some familiar names there. Like I said, if you know anyone else who might be interested in scars and scarring, do put them in touch with me. We've got a closed practitioner group which is not limited to people who've just done the course. We want this information about a scar treatment to really be available to as many people as possible, even if they can't at this moment in time access the training for whatever reason, to location or budget, or just they might not have the capacity at this moment to fit it in. But I think it's really important to have some support around and some therapists who you can ask. So I hope you stay in touch. Hopefully see you tomorrow for Get Moving Scar Tissue and Stiffness.